Welcome to the Unlock Wellness Podcast. I'm Dr. Casey, and I'm excited for today's guest. Dr. Lindsey Mathews is a doctor of chiropractic and the founder of BirthFit, a movement to empower and educate women going through the motherhood transition, whether that's pregnancy, birth, and postpartum. And Dr. Lindsey, thank you so much for coming on. I'm so excited to have you.
Well, thank you. I really appreciate you having me and reaching out to get me on the show. This is great. I love talking about BirthFit.
Yeah, no, I seriously love what you're doing. It's helping a lot of
Aw.
people. But yeah, do you want to just jump in with like your backstory and, just a little bit about you so people get to know you and how you became passionate through your journey about pregnancies and just helping women and empowering them to become healthier through that process.
For sure. And I'll try to give you the super brief version, and I could definitely talk about it for like an hour, 2 hours, a whole night, whatever. But I'm a big believer that we each have our life's passion, our universal plan kind of designed for us. And it's up to each of us to sort of unlock those doors. And, the doors for me may not be the same for you or the next person, but I have to sort of achieve and go through some obstacles in order to unlock the doors that are there for me. And, I think my whole life I knew that I was here to help people. And, I realized that from a very young age. I think I was about 9 or 10. And I grew up with asthma really bad, and they labeled that on me from like 2 years old. But so I was always around Western medicine. And, I thought, okay, if people are helping me, I want to help people. And, fast forward, you get to high school, and I started I want to say growing up into high school, I played soccer a lot, and then I grew up in Texas, so I was a cheerleader, and I flipped around a lot. But my junior year in high school, I tore my ACL, and that was a pretty devastating injury for
Right.
like an athlete, somebody that was extremely active at that time. And I was planning on going to college, playing soccer in college, and I identified heavily as an athlete, and my whole world was shook whenever that happened. And at that time, this was like 2000. Yeah, 2000 on the dot. So almost 16 years ago. And I interviewed different surgeons, and my mom was actually really, I guess, forward thinking in this aspect. Like, we had the team doctor that was at our high school, and he told me he could operate, but I'd only be at 80%. So then we started exploring orthopedic surgeons outside of, the general high school recommendations. And I came across this surgeon. His name was Dr. Jesse DeLee, and he's out of San Antonio, Texas. And he was great. He's a big old guy, and he wears cowboy boots with his scrubs. And he told me that I could be back at 100%, but that the majority of the work and everything that went into it depended on me. And he required a lot of his athletes to do prehab or training before surgery for at least a month. And then after surgery, he really wanted them to like explore alternative options, whether it was massage, chiropractic, roughing, acupuncture. He just like said, get out there and take care of yourself. And
Right.
for me, that was like, oh, this guy's brilliant. So I did that. I went with him, and I was still planning on like, okay, I'm going to make a comeback in the soccer world, and even in the cheerleading gymnastics world. I was determined to be on the squad the next year. And it was a tough year. It was definitely a big fork in the road for me and influential in the rest of my life. But before that surgery, I was training for surgery at that point. I wasn't training anymore for soccer or for cheerleading competition or anything else. I was training to go into that surgery. And, if you fast forward to what I do now, it's like, it's definitely imprinted in me. And, that's how we approach birth, whether it's a vaginal birth or a cesarean birth. We know that we're training for birth. So yeah, I went into that surgery, and the surgery was phenomenal. I was moving my leg immediately after surgery. I was able to walk out on crutches. I was back doing flip-flops within 7 months.
Yeah, it's
You know, it was,
awesome.
yeah, and I think, not only he was a great surgeon, super skilled, but not only that, but the mindset of the training that he had me do, and just all the extra avenues and just exploring different routes.
Right.
I think he was so ahead of his
I
time, and
mean,
so
how different would it be if all surgeons
oh,
approached that type of situation like
oh,
that? Like
it would be
it would
amazing.
so incredible and like life
Yeah.
changing.
Like, I'm more grateful now for meeting him than I was, probably at that time as a, junior in high school. But yeah, he definitely influenced me there. And, about that time, I met the local chiropractor in my town. And that's when we established our relationship. I started going to see him at least twice a week. And then, fast forward through college, I went the pre-med route at Texas A&M University, and um, I realized on a medical mission trip to Africa that I couldn't heal the world by prescribing medication. So I came home and I started shadowing this chiropractor again. And I was like, tell me more about what you do. Like, this is interesting. And, from there, I applied to chiro school. I got in, and I chose the chiro school that was furthest away at the time. And that just so happened to be in California. And so that's what brought me out to California in 2006. And upon graduation, I worked with three guys, and it was more of like movement rehab focused clinic. If you've heard of DNS and stuff like that,
Right.
we've done a lot of that, and we'd adjust patients and we'd get them moving again, and that was our goal. And at the same time, one of us would be out of the office at all times, traveling either on set or with an athlete, and we would be getting them ready for their big stunt or their big soccer game or baseball game or whatever. So, it was really, I want to say, like, performance driven. And, by default, I would get all the women that would come through the office,
Hmm.
where the guys are like, oh, she has this like weird bladder thing or boob thing, and I don't know what to do.
Right.
So she's on your schedule. And I'm like, what? Um, so that's how I started getting exposed to more women specific issues, I
Hmm.
guess. And, going through college and chiro school and, that route, I thought I was really wanting to do the whole sports thing and stay in that world because that meant a lot to me growing up. But it just didn't drive me. And, I started researching more and more about women's health, prenatal, postpartum, and I just became fascinated by it. And I took the ICPA diplomat program.
Hmm.
I did doula training twice because I loved it so
That's
much.
cool.
Yeah, I did hypnobirthing, sacred pregnancy, childbirth educator, spinning babies, you name it. Like, I signed up for it, innate postpartum. And it was probably, seminar, Western medicine, or, chiropractic related stuff, or it was super hippy dippy where I would travel to like the outskirts of Ojai and sit in a sweat lodge with people
Yeah.
and learn the traditional stuff that they would do, maybe in a tribal sense. Um, so I just became really fascinated by it, and I started a blog, and the blog was just my opinion. And the more I uncovered, and if you think back, like growing up with asthma and just being really, I want to say, dependent on the Western medicine world,
Hmm.
and then, like, as I grew up, I slowly realized, okay, I started paleo diet like 10 years ago. And then I just became more and more in tune with what I put into my body, how I took care of my body. And then as I started this blog, and we became, like, my clients and I became more in tune with how it influenced pregnancy, birth, and postpartum, we're like, this just makes complete sense. And, I realized that at that point, the Western route that we have in place as far as maternal care isn't the answer, and it's
It's not.
not really going to make anything better. And the system we have in place right now is basically, I like to tell people, it's a shit show, and we're just cleaning up the mess.
Right.
And growing up exposed to that Western medicine world, I thought the only way to give birth was in the hospital. And when I did more and more research, and I would, attend births in the middle of nowhere or at a home, or at a birth center, I was like, oh, well then, yeah, maybe the thought of having kids does appeal to me, because for me, I was like, there's no way I'm having kids because I'm staying as far away from the hospital as I can. But the more I read, the more births I attended, the more I realized this is so freaking natural.
Right.
We're just putting our big fat feet in the way. And
Exactly.
yeah, and
Treating it as a
so that,
disease and not a natural process that our bodies were
for
made to
sure.
do.
Yeah. And, really, I forget if it was Dr. Michelle Odent or some other midwife somewhere that said, hey, as a doula, because I was always asking, what's the best advice you could give me, and
Hmm.
that's pretty a loaded question. Like there's 1,000 things you could say, but somebody was like, just observe. When you get there, just watch them. And if they need support, you'll see, and your gut will tell you, but don't interfere. Like birth is natural and it's different for everybody, and it will unfold as it's supposed to. And so I thought that was really magical, like just stand there and observe. But that's really how it started, like in a short story. Blog started in 2011. I started, I guess, turning it into a business, or, a thing. I want to say a thing. Wouldn't consider it a business yet, but a thing in like 2013. And then we started accepting regional directors in like 2014 and 15. And, you know, about 2014 probably was the year that I was like, oh, okay, I should get my shit together, because if I'm going to change the world, this is the way, and this is what's got to be done. So yeah, since then we've grown. We've basically doubled in size each year as far as regional directors go, and there's online educational tools and empowerment tools. There's in-person resources that are in the form of the regional directors, or in the form of a BirthFit coach or a BirthFit professional. And it hasn't let up, and it just keeps doubling, and people are seeing the value in it. And I think people are realizing, if like they realize, as far like with nutrition and
Hmm.
fitness and just their everyday life, that, oh, this is even specific to birth. Like if I need to play an active role in my health and in the health of my future kiddo.
Right. Absolutely. I mean, it's just a great thing to have like in place in your own life. I mean, obviously, and then through the pregnancy, and then something that you can
Mhm.
implement into your children's life, and then they do. It's just a domino effect.
Yeah.
Just I mean, positive, things within their health. And did you want to go into like with BirthFit and just what the program process kind of looks like? I know you just touched on it a little bit about what they
Yeah.
can find on like different trainings, but exactly how it works.
Yeah, for sure. So our main goal is to cover the world in regional directors.
Hmm.
And regional directors are the community leaders. They're like the hubs for resources, information. Um, these women and men, I mean, we don't have any men yet, but they're more than welcome. They, they, most of them actually are chiropractors, or they can be strength and conditioning coaches, but they all wear like multiple hats. So maybe they're a chiropractor and a birth educator, or a strength and conditioning coach and a birth doula. They have to be able to like eat, sleep, breathe our four pillars. And so the four pillars are fitness, nutrition, chiropractic, and mindset. And I basically came up with those four pillars as the criteria for taking on my doula clients. Like if you're eating shit and processed foods, on the simplest terms, it's
Right.
going to inflame your tissue, and it's going to set you up for failure somewhere throughout your pregnancy. Or, if you turn up Labor Day and your tissue is already inflamed, like the cervix area, vaginal tissue, stuff like that,
Hmm.
that's not really optimal.
Right.
Birth is an inflammatory event, so help yourself out there. Um, Then like fitness, and fitness to us just means functional movements, breathing, strength, range of motion. Like you're incorporating your whole joint range of motion, and you have to have strength through that whole range of motion. Um, and this is all covered at our BirthFit coach seminar.
Mm-hmm.
And we go through prenatal training, postpartum training, what to do, what not to do. And we do believe in strength training just as much as we believe in cardio endurance training. We believe in strength training just as much as we believe in range of motion, flexibility. And those are all super important.
And at different levels depending on where they're at, right?
For sure, for
Yeah.
sure. One of the little quotes we like to say is, meet mom where she's at.
Mm-hmm.
And that's, the case for prenatal and postpartum. When a woman gets pregnant, she starts to turn into the superhero of a person and her physiology changes. And, if it's almost like doping. Like if an Olympic athlete was doping, like her blood becomes so efficient by the end of pregnancy, it's so hard for her to get a sweat on, let's say, like at the end of that third trimester.
Yeah, no, it was funny. I had a professor in undergrad at WVU, and she was really big into triathlons, and they didn't have any kids, her and her husband. And I don't think that was something that she was interested in, but she was just like, she's like, I remember when there was a day in class where she was like, I don't think I'm going to have children, but I think if I do, it'll just be so I can be that superhuman after labor that it'll be, pretty much like doping. And she's like, pretty much so she could be like the best triathlete for this event. But she said it in a joking way, but it is true about how, it does make you a superhero. Like the condition that you're in afterwards it's amazing.
Yeah. And taking the best version of yourself into labor and delivery, or whatever the birth scenario holds for you, I would say like that's an optimal setting there.
Mm-hmm.
Yeah, so we talk about that at the BirthFit Coach Seminar. We also talk about postpartum, and for us, we're like, people view pregnancy as fragile, and then they want women to get back to their pre-baby body or back in the gym, and it should be the other way around, where yes, there's superhero during your pregnancy and you're strong as hell and you're conditioning, and this is great, but let's have a little respect for the postpartum period. And one of our main rules is nothing. Don't do anything for 2 weeks. There's cultures all around the world that will take care of mom, do her chores, nourish her, feed her, take care of the other kids, and they'll do that for 3 months. They might do that for 40 days, but they have systems in play, whereas our society here in America doesn't have shit in play.
Go back to work in a few weeks. Go get back to yourself. It's crazy.
So bizarre. And as far as like the fitness thing goes, I relate this back to my knee. Like after I blew out my knee. I blew out every freaking ligament besides, with including the ACL, sorry, in my knee. And not only did he have a system in play prior to the surgery, but there was systems and protocols in play as far as physical therapy, rehab, chiropractic, everything on the other side.
Right.
And no matter if it's a vaginal birth or a cesarean birth, which is a major abdominal surgery, there's nothing in play for postpartum moms in our country. And that's basically, I keep jumping all over the place, but that's basically why we started our postpartum series that each of the regional directors teaches. So like I mentioned earlier, the regional directors are like our bread and butter, and we would love for everybody to be able to connect with a community, a support group, and that would be done through a regional director. And if that's not the case, then there's online options as far as consultations, prenatal, postpartum programming, stuff like that. But each of our regional directors does in-person consultations. They teach the BirthFit prenatal series, which is a birth education course.
Mm-hmm.
We work through like birth preferences, birth mission statements, preparing for like postpartum planning, stuff like that. And then you do that course with your partner. And then on the other side, each regional director teaches the BirthFit postpartum series, which is rehab for after baby. And that can be a vaginal birth or a cesarean birth. But those are kind of the signature series that each regional director teaches. And, like I said, it's super important to stay connected or get connected with a community more than anything, because these people will, probably have the same sort of issues or problems or obstacles that you have as a mom.
Right.
They might have already conquered it, and they might have great tips for you. Or, as many of the moms do, they show up to class and they'll cry together, and that's
Right.
huge.
I mean, it's all about community with
Yeah.
and a positive, healthy community, and not one that's
Yeah.
fear-based that you're reading on Google.
Mm-hmm. Mm-hmm.
Yeah. And then you said the other two pillars were chiropractic and mindset, right?
For sure. Definitely. And we, as I said, most of our regional directors are chiropractors,
Mm-hmm.
but like for me, myself in Los Angeles, I'm located on one side of the town or the city, I say town.
That little town,
So we're getting a BirthFit regional director in Silver Lake, which is all the way on the other side. And then there's a BirthFit professional in the middle. So, the best thing I can do is refer somebody to a competent prenatal and postpartum chiropractor so that she can go see this person once a week during her pregnancy. And that would be minimum, once a week throughout her pregnancy. And people always ask me why, especially if they've never done chiropractic before.
Right.
I'm like, oh man, in the simplest terms, like your body is your vehicle for birth, and your pelvis is holding the baby inside the uterus, and this uterus is suspended via all the ligaments. So, like, let's just think about that for a second. If this is not moving or it's restricted on one side, then it's going to lock up. Baby's not going to have all the room to move around. And baby doesn't know where to go, doesn't know, like, they hear you talking, but you've got to provide the optimal space, the optimal surface area for the baby to go head down, which is their biggest part on their body right now, and line up with that cervix and then just spin their way out. So
Right.
when you start to say things like that, then they're like,
Okay.
oh, okay, that sort of makes sense. And I always tell people, like, look, if, we talk about this at the coach seminar, if you're training a client, and specifically these coaches are probably seeing these women 2 to 3 times a week, which is more than anybody throughout their pregnancy.
Right.
And I'm like, if you are seeing a woman and she does not know what position her baby is at week 25, 26, 27, ask her. And if she doesn't know, send her to Spinning Babies, learn how to map, or go in and ask her midwife and OB-GYN to tell her what position the baby is, because they can tell that at that time period. And between weeks 25 and 32 is the most optimal time to make adjustments to the woman's body and to help baby get head down. So, like, if you never have done chiropractic, get in there at weeks 25. And then people are like, oh, okay, I see what you're doing here. But man, chiropractic and mindset. Oh, mindset, I would say, is the biggest thing. Because you can check all the boxes. You can check the chiropractic box weekly. You can check I'm eating, clean diet, good fats, good proteins, grass-fed everything. You can do, everything that people have told you to do. But if you have not embraced this growth mindset into this prenatal birth postpartum journey, then when you're faced with an obstacle, it's going to be very hard for you to go through this obstacle, and you're going to want to go around it, skirt the issue, and avoid the uncomfortableness.
Right.
And one of the mandatory books that I make everybody read on our team is this book called Mindset by Carol Dweck. And it talks about a growth mindset versus a fixed mindset. And I'll give you an example. I have clients or potential clients that'll come to me and they'll say, my mom and my sister, they both had C-sections, so I'm probably going to have a C-section. And I think, well, I doubt that runs in your family, because 100 years ago, this was not common.
That's not where it started.
No.
Right.
So let's think about this. But if you already think you're going to have a C-section, then I can guarantee you're going to have a C-section.
Oh yeah. I mean, it's like biology of belief stuff. I mean, like Bruce Lipton. I mean,
totally.
It's just, it all goes together.
Yeah, totally. So there's a lot of mindset practice, awareness, We work really close with this app called Expectful. And they're like, if you've done Headspace, they're like Headspace for pregnancy.
Cool.
Yeah, so getting the mindset ready, like the other book I recommend is The Obstacle is the Way. And I say this because at some point in the motherhood transition, you're going to be faced with the most difficult, value challenging obstacle of your life. And I say this because it's different for everybody. I don't know what the challenge is for me. I don't know what the challenge is for my mom that I'm seeing later today, whatever,
Mm-hmm.
and it could be presented as issues conceiving. It could be presented as, some sort of maybe all of a sudden during pregnancy, working out at the gym doesn't feel good, but yoga and walking feels good, and functional progressions feel good. Something like that. It's a different avenue for you. Maybe you have some sort of issue going on later on in pregnancy where everything was fine, everything was glorious, but then all of a sudden baby is breech and you're 36 weeks. And you're like, you've done all the chiropractic twice a day, 5 times a day, whatever.
Right.
You've done all the inversions, and baby's like, hell no, I'm not going head down. Because there are those babies that want to be born a certain way. And, I'm thinking of one mom in particular, and this was her journey last year. And, she had a beautiful, healthy pregnancy, and her husband took the BirthFit prenatal series. They did everything. And, I saw her as a patient twice a week. And what's funny is whenever we found out this baby was breech, this was like weeks 26, 27.
Mm-hmm.
I for sure knew at that point that baby was not turning. And something in me and then even in her later on, she was like, I don't think she's going to turn. And I was like, yeah, I don't know. Let's keep doing the thing. Cause whatever, whatever happens. And regardless of what happens, as long as you're taking care of the body's going to take care of you.
Right.
And finally we get to the 36, 37 week, and, I've worked with them really closely, but, we start making lists. Okay. Now our options are vaginal breech home birth, vaginal breech hospital birth, cesarean, or yeah, those were like the 3 main options.
Mm-hmm.
And she knew, like, her original plan was not to be in the hospital, it was to be at a birth center. But in California, 8 years ago, a law was passed that midwives can't deliver breech babies. And there's only one out of hospital doctor in our area. And then there's about 3 in hospital docs that will deliver vaginal breech births. And 2 of them will put you in the operating room hooked up to an IV, and you can labor in there,
Mm-hmm.
which obviously is not anywhere close to how she envisioned laboring. And then you can go the C-section route, and they did their research, and I made them go research and then come back with questions, go research more and come back with questions. And they came back with, I think if we went the C-section route, that the best thing for baby would be to labor and then have a non-emergency C-section. And I said, you're exactly right, because then baby gets some of those good hormones, but then there's no stress involved. As
Like
far
it was
as
ready to come. It's just,
totally,
yeah,
totally.
wasn't scheduled.
Right. And so they ended up, and this took them probably about 2.5 weeks of notes and decisions.
It's a big decision,
For sure. And they decided to go with the vaginal breech home birth, and they had an awesome birth experience.
It's amazing.
But yeah, but
You don't
for
hear
them,
enough about that too.
oh no. But for them, that was the hardest decision that they've had to make probably in their life.
Absolutely. Because you want the safest thing for the baby. Obviously that's the most
Totally.
important thing to a parent.
Totally. And, for a parent, you have to get really clear on what you value, what your philosophy is. And, I think this is just my belief, but I believe the whole motherhood transition tests you and prepares you for that. And if you're not present or you're not um, taking the time to absorb and be present in that space of awkwardness, that space of learning, that space of comfortableness where growth happens, then you won't transition or you won't embrace that transition. And then all of a sudden you're a mom and you're like, oh my God, this is a shit show. Um, so I think, at some point I've actually had a number of people that have had birth injuries that have been sidelined, like no moving, nothing during the postpartum, like initial 6 to 8 weeks. And for them, I think it was, they moved their entire life and all of a sudden they have to ask for help. And that's really hard,
Yeah.
you know? So like I prepare everybody with, hey, you're going to be presented with a freaking hard challenge at some point. And that's where that growth mindset comes in. Like you have to be able to see this obstacle, know what's important to you, know who you are inside, and then go through this obstacle and come out stronger the other side.
Absolutely.
Yeah, so that's the big idea, I guess.
Yeah, I mean,
But
mindset, it's just, I mean, mindset could arguably be the largest of those pillars. I mean, it
oh,
really
for
is.
sure.
I mean, for myself, like, I did a birthing meditation audio, like, every single day that last month of
Mm,
pregnancy. And
yeah.
it was like just straight, like, the meditation was just about, like, just getting you focused, and it was kind of talking you through as if you were in labor. Like, this is happening now, like, you're breathing, you're counting, and I can't tell you, like,
Totally.
how much that made a difference. Like, just cues that, like, during really tough times, like, I was counting down, like, 3, 2, 1, and telling myself to relax. And, like, I can't imagine not
Hmm.
having that kind of focus. Like, it made such a difference. It was 18 hours of work, and I just can't imagine not having that. But we were able to have a really amazing water birth, and just
Oh.
having that, I mean, it made all of the difference. And, like, I'm sending, like, meditation birthing audios to, like, all my pregnant friends now. Like, I love it. It's just amazing.
It's like I related to that, like people relate to sports well, and like you said, if you're counting down, you have like those small tangible goals are you're training your mind. And if those like triggers or those anchors are not already placed in your mind, then they're not going to be useful in come game day or
Right.
performance day, whatever you want to call the big day. Um, but yeah, you have to practice. You have to have deliberate, intentional practice throughout those, 35, 40 weeks. And that's what's going to, like you said, you come back to it, you're comfortable with it, you've trained there, you've been there before,
Hmm.
so it's familiar to you.
Right. Yeah, absolutely. And you mentioned a lot of really great resources. I wrote all of them down. I'm going to put them all in the show notes. Did you have any in particular that you wanted added that you didn't mention yet? That
Oh,
besides the BirthFit site and BirthFit podcast, which is amazing. But I got to give you a plug too. But yeah,
yeah.
did you have any resources besides the ones you mentioned?
Well, if you're a chiropractor and you haven't checked out Spinning Babies, you got to do that. Um, Spinning Babies is great. It was one of the first, I want to say, seminars, workshops I took, and just becoming familiar with, like, hey, yes, you can move in labor, you can make adjustments during
Hmm.
labor, stuff like it's a dance, and finding the rhythm of labor is like you got to tune in there, and I think they're really good about communicating that. What there? Any book by Michel Odent. He's a French OB-GYN. He's freaking brilliant, and one of his books, I forget which one it was. I think it's called Childbirth and the Future of Homo Sapiens.
Hmm.
That was the first book I read childbirth related. I don't know how I came across it. I don't know who gave it to me, but I realized that, oh my God, if we don't change the way we give birth or bring humans into this world, we're going to basically extinct our population, like through naturally selecting against the oxytocin system via C-sections.
Right.
And so that book was freaking brilliant. He's done a ton of research. And I don't know if he travels anymore to speak, but I had the opportunity to sit in a discussion room with him. And the guy knows every study he's ever done. Like, if you ask him a question, he's like, oh, I remember a study we did from January 1973. And you're like, oh my God, I can't remember
Line
what I ate
15 and
last week.
16. Yeah,
Yeah,
that's
like
crazy. That's
brilliant.
amazing.
There's another book called Active Birth by Janet Velasquez that's really good. It's a simple read too. It just talks about using gravity and the vertical positions and why walking and squatting and lunging are all super useful. Um, yeah, I'm trying to think what else is out
There
there.
was one you mentioned. Was it Obstacles the Way? I kind of missed the
Oh
name.
yeah, The Obstacle is the Way
Okay.
by Ryan Holiday. It's a great, that and mindset focused books,
Hmm.
but I make everybody on our team read them.
That's cool. I know that's a good thing. That's just to get the whole
Yeah,
team on the same page. But and
yeah,
um and what is the best way for people to follow what you're doing, like on social media and also your website? That way they can, check you out and see what it's all
for
about.
sure. We have a super active presence on Instagram and Facebook, so that's where I would start. And if they have any questions, just shoot us an email, info@birthfit.com. We have a free webinar happening Monday, 5
Awesome.
p.m. Pacific Standard Time. And this webinar is actually talking all about the road to regional director and then other avenues like a BirthFit coach or a professional.
Is that going to be recorded too?
Yeah,
Okay.
yeah. I usually record all the webinars and then post them under the education tab on our website.
Awesome.
So if you miss it, you can go back and check there. And there's some good webinars up there from this past year. So
Perfect.
yeah,
And then
lots of info.
yeah, and then Dr. Lindsay, just one closing question that I ask
Yeah.
all the guests now. So yeah, so put you on the spot. But if you have just one piece of advice that you could give the audience, just something maybe that you've learned through this whole journey, or something that you think that would help them. If just if you had one piece of advice, what would it be?
Oh gosh, I wish I could remember this quote, but the idea is, and I've been really embracing this a lot lately because, like I mentioned to you earlier, I lost my cat, Angel, who was 20 years old, and she's been with me through everything. But we helped her transition, and that was not about our journey. That was more about her journey, and she passed away peacefully at our house. We used the help of like a death midwife, and it was honestly so freaking beautiful. To me, it was very familiar, like I was attending a birth, but you're attending a different kind of transition. Um, and through that, I had to learn to embrace the uncomfortableness and the space. And between each stimulus and choice we have, there's a space there. And this happens in birth, and this happens in life, and before you put something in your mouth to eat, and so on.
Hmm.
But learning to embrace that space, and sometimes that space is awkward, sometimes it's ugly, sometimes it's really sad, as I've been experiencing. But just being present there. And I have this little motto I tell myself, and it's breathe deep, be present, and feel from the heart. And if I can do that in that unknown, uncharted space, then I'm a little more tuned in with the universe, with the world, my body, and so on. So that's what I would say, is just embrace that space and tune in and feel from the heart. And you can take that into birth, you can take that into your career, and so on. But yeah, that's what I would say there.
No, I love that. That's perfect. But thank you so much, Dr. Lindsay, for coming on. I really do appreciate having you. I
Got it.
seriously love everything that you're doing.
Awesome. Thank you.